Hello everyone, it's Kathy Boyce here. Welcome to the very first case history presentation for the Q&A exchange on silver fluoride. Look, it is a amateur presentation. I've not done anything like this before. This whole season of COVID-19 and getting our information out virtually has been a real growing curve for many people, and I'm certainly one of them. And so, excuse the amateur presentation, but don't let that distract you from the quality and the excitement of the information that we are actually going to be presenting to you today. Trudy has done a wonderful job in treating her son, and we'd just love to share that with everybody. And here we go. Enjoy.
Alrighty. So what I'd like to do is I'd like to welcome you, everybody, to this little. It's basically just a discussion on what we've been doing with silver fluoride. Now, when I say we, I'm talking mostly in this one. We're going to talk about the case history that was presented to us so beautifully in pictorial evidence from Trudy, who is up there in the corner, called Annika. And Trudy, this is Trudy's baby, basically. And so Trudy and I used to work together when she was working in Townsville. And then what happened is she moved away, and she came to one of the silver fluoride seminars down in Rockhampton. Bundaberg was, sorry, no, I was in Brisbane and you came from Bundaberg.
Brisbane.
Yeah, that's right. And so basically she picked up everything that she knows and then went home and ran with it. So what I'll do, Trudy, I'll get you to just chat to everybody about, where you work and where you were doing, your silver fluoride work. And also then we'll get on to the case history of your little fella.
So I'm in Bundaberg at the moment, and I work two part-time jobs. I work for government, I work for private. One is anti-silver fluoride, and one lets me run with whatever I want to do, which is kind of nice. So it was time for my boy both my kids to have some school dental checks. And so I let them go and have their radiographs and a check, and we noticed that my boy had a 6'4" D to do. And so then we were sitting there thinking, well, he actually is not too bad a flosser. What should we do? He has got a history of hyperplastic E's. We've been keeping an eye on those. Yes, we've tried covering them with Fuji and things like that, but he's never ended up with them other than breaking down enamel. We have never had them cavitate, which is great. So he's worked really hard at looking after those. So having a distal on a D didn't surprise me. I was a little bit upset because he is a flosser, but yes, my kids have juice and they have sugar and they don't always brush their teeth, and he is my sweet tooth, and he is the one who's a little bit more rebellious when it comes to hygiene, full stop. So of course he's going to be the one with the cavity. So hi Rhonda. So I decided do we let it go? Do we put silver fluoride on? And I thought, why not use my child as a guinea pig? It's right there in front of me. It's easy. I don't have to get consent. We don't have to try very hard. And so I got him in the chair. And we did, hopefully everyone who's on here has actually seen the pictures that we've uploaded.
I'm just going to put them up again now, okay?
Yeah, okay, no worries. So we did the Super Floss silver fluoride. I did disclose that this child is dental phobic, so we didn't actually get the whole 3 minutes on there. But we got a good 2 minutes, I reckon, at least. So with that, we just decided to follow it. You can't really see the 2-4 there. So I'm thinking that he was going to be about 2 years off losing this, being a boy. it happens that he didn't even get 12 months out of it, so that was great. And then the tooth fairy was so kind to let us keep this 6-4, so we actually have proof, and it's right here.
Okay, so what I did with that other x-ray is, Trudy, I just clarified it a little bit so people can sort of see the depth of
so
the...
now this is a wet x-ray, and I have taken a photo of that on an iPhone. So it's a picture of a picture. And then the other photos I've only taken on an iPhone as well. So the photos of putting the superfloss and the silver fluoride on, that's my son and my beautiful gloved hands. And that is literally just done with an iPhone. So if you have a look there, you can even see that 6.5 is a little bit hypermin there. So it didn't surprise me that this was the D that was potentially going to have a cavity if there was any of them in his mouth. The other spaces are a little bit more open. Now this is the exfoliated 6.4. No marginal ridge breakdown. So once again, that's just taken the other day on my kitchen bench with my iPhone on a piece of black Tupperware. Nothing fancy here, but the tooth definitely had a decent amount of like erosion there, so it's definitely done its job. But just to know that that marginal ridge is in such nice condition just blew me away. I was expecting to see some sort of breakdown, enamel fracture or something on that space, and there's nothing. So yeah, I'm actually blown away. So, and then there's the cavity there. Because by the time I've taken some photos there and it's not in his mouth anymore, it was really black, but part of that has actually come away. So that would be that burnt toast that you're going to scoop out. But look, there's not even any white frosting demineralisation around that cavity space. And we just kept flossing it, and I didn't even put any more Durafat or anything on there. He just kept it flossed and brushed. So to be able to get that much further out of nearly, what I think we were talking, oh, I'm so sorry, I did have it all up on my phone here. Are we talking 11 months? I think it ended up being...
I think we worked out, I think it was 9 or 10 months.
Okay.
Yep.
So if we, I mean, it kind of puts it into perspective to whether you would keep this child then on a 6 to 10 month recall, or whether you would keep them on a 8 to 12 month recall, that kind of window once this happens. So it just comes down to the child and the family compliance and all those sorts of things. So this is the child that's not compliant, has, you know, on and off issues with hygiene, and is a sweet tooth. So putting all those things into consideration, I was quite surprised that didn't break down any further.
Was that actually cavitated there, Trudy? Like when it exfoliated, was there a small cavitation there? It looks like there was.
Yeah, so where the blacker part is, it's not. But further down, it is a little bit cavitated just there. So that burnt toast that you would have scooped out would have came through onto that. So
okay,
yeah,
and the burnt
and then
the dead decay. That the burnt toast is the dead decay, and that would have been, because that was in there and that was still in place. That would have been a reservoir for other fluoride and calcium and phosphates that are in the saliva to be actually continued to be drawn in and absorbed and going to remineralize the tooth.
So he didn't ever end up with much issue with food trapping in this space because that marginal ridge was still intact, so he still had some contact. We had more of an issue with areas where his E's are more broken down on that marginal ridge, and he has food packing. So this space was just kept flossed. It didn't need to be opened up to allow the food to pass through or not trap the same. Yeah, I'm blown away. That's the inside there. So the black area there is actually his pulpal horn. So you're actually looking at the orange, the more browny orange. So that's what it looks like on the underside. And once again, there is no white spot lesion underneath there. It doesn't look frosty or chalky at all.
Okay. So did you actually probe that at all? Because I've done that with teeth in a similar thing. I've probed it just to see whether it was soft or hard.
I haven't. I don't have a probe at home. And I haven't gone back to work yet. So
it'll be dried out by now.
Yeah, I could have a go. But it seems, it doesn't seem too soft to a fingernail or anything like that, or it doesn't have that sort of leathery kind of feel to it. But yeah, I'm just, yeah, like I said, because there's no white spot underneath there. Yeah, I just couldn't believe how hard it actually even looked to the eye, that you wouldn't even think about going and probing that if you saw it clinically anyway, because there wasn't that whiter ring around that remind area.
My question was there any sign of staining on the mesial of the E? Because sometimes if that's already demineralized and you're treating the D, then sometimes if that has been demineralized, it will stain up a little bit, but it's a very interproximal stain. I mean, it's not a concern. But did you notice any?
I haven't, but if you give me 20 seconds, I can go and have a look what I can find. Would you like me to try?
Yeah, why not?
And I'll send it to you. Why not? Okay, I'll be back.
Okay. So if anyone's got any questions, just unmute yourself and pardon me, we'll chat about that. Because I'd like to know, I mean, I do this all the time, interproximal remineralisation of teeth, and you've seen some of the case histories that I presented on the Black Diamonds Rock Facebook page. But is anybody else using this? Now, this was done with CSDS, of course, and the reason why I choose to use CSDS is because you can actually put the silver fluoride component on for 3 minutes without any risk of tissue damage, because it is a pH of 6.3. So when you're doing this kind of work and you're putting, you know, superfloss in there and having something that is so close to neutral in the pH is a really good advantage, because you're also allowing maximum uptake of the silver and the fluoride ions into that prep. But if anyone's got a question, just unmute yourself and ask a question until Trudy comes back, if you like. With silver fluorides at the moment.
Kathy, we're about to get silver fluoride in with public health in central Queensland, so it's been approved. We're waiting for it to arrive, so I'm just starting to learn about it all now. So this is fabulous. Thank you.
You beauty. What health service district are you in?
Central Queensland, in the Rockhampton.
Oh, good. It's been a mission of mine to have it in Queensland, all over Queensland. And one of the reasons being is Queensland is still so unfluoridated. And if there's ever a need for this kind of minimal intervention but highly effective use.
Certainly needed in our area. There's just rampant caries. It's incredible. So Our acting principal oral health therapist has worked hard, and now our principal dental officer has agreed, and so we're waiting for it to arrive, and he's very keen to use it as an ART non-aerosol approach with COVID, so that's great.
Yeah, yeah. Okay, Trudy.
Did you get it?
Oh, no. Oh, was that a photograph? Okay.
Yeah. So there is a tiny little bit of staining there. It was really hard to focus on that. So we have ungloved hands because we're at home.
Yeah, yeah. All right.
So
I will word for us, but you can hardly see it. Okay.
there's just this tiny little black line just above the interdental papilla,
Mm-hmm. Yeah.
if that makes sense. Yeah. Upload the picture so you guys can have a look later. But even the other photos that I got in the chair showed that this 6.5 is a little bit hypermineralized. You can't see that on this photo, so just keep that in mind, that it is the same tooth. Yeah.
Right. Okay. Now,
Is there more questions?
Previous X-ray. I'm just going to go back.
Could you get away with using just regular floss down there? Will that put enough in there?
It's not, it doesn't last the same. I have used those tapered micro brushes on kids that didn't like the feeling of floss. And that has worked okay, but I think there's not enough solution on the micro brush the same as what you can keep adding to it when it's on the super floss. So, you know, you get these little kitties that just can't deal with too much in their mouth at the same time. So sometimes you've just got to go with what you've got. And I've just kind of come to the conclusion that something's better than doing nothing, that I managed to do 2 other days of the week. You know, I've worked in toothache clinics and you'll say, oh, you know, Johnny's got other teeth there that need filling. And if you had the silver fluoride, you could just be popping that around everywhere until, you know, mum can bring Johnny back. Whereas now we're just sitting there watching those holes get bigger.
True. Yeah, and I have used different flosses. I've played with different flosses. There was an expanding floss that I used, but I didn't find that to be as effective as the super floss. And the super floss I just chop in half so that the fluffy bit is only half as long, and so that you're saving on the super floss as well. But you want something that's actually going to be quite absorbent, so it's maximizing the uptake of the silver and the fluoride, and then transferring that into the interproximal, you know, region. And because you've got that right down in, you know, as you floss something down, you're actually getting it right down into the you know, past the contact, and most of the decay is happening at the contact. You do find that there's still enough material, a silver fluoride material around, that it's still very effective. And I use this on permanent teeth as well, and even though their contact is a lot bigger and greater, you still get enough of that contact. So I've got a case that I've been following. It'll be into its 2nd year of a 1/6 MO that should be having photos in June. We will see whether we get photos in June. Yeah, but and I've done, you know, long, you know, 20-month, 24-month follow up, where you truly thought that this one would last that long and it didn't. I've certainly had them last that long, particularly when you put some education in there, and there's an element of oral hygiene and flossing and regular toothbrush using. So, and occasionally I've had the marginal ridge breakdown, because I'm very when I say breakdown, it would have been a case where I was going, should I or shouldn't I? Let's just see how it goes. And I did. I put silver fluoride in, but when the marginal ridge breaks down, the actual remainder of the tooth that's already there is arrested. So it's easy to fill. So so in this case, go on.
Sorry, what's the limit to how far in the cavitation can be before you, what's a contraindication basically?
The contraindication of using it interproximally.
Yeah, how far in? Like
I definitely allow it personally to go, you know, like a lot of times they go, oh, if it's just past the DHA, no, I can go, you know, well past that. When I say well past, if it's significantly past, but if you have a look at, or do you want me to bring them up? Do you want me to find these other slides to show you?
Yes, please.
Okay, right. Yeah, interproximally it works really well. Obviously, that is where you have to take X-rays. Taking X-rays is part of a decent dental checkup in my mind. And anyone who gets to about the age of 7 who hasn't had a set of bite wings has them in my clinic. And the reason why I do that is because now I can find this kind of thing, whereas I used to look at it from a point of, well, let's find if you've got any little tiny hidey holes so that we can keep them very small, remembering that a lot of patients, we're talking Queensland too, are very unfluoridated. And now I'm looking at them so we can get silver fluoride on there, and we never have to do it again. One of the things that you have to be a little bit mindful of, because somebody was, it may have been you, Christine, said that you Victoria? Right.
Yes, I am. Sorry.
So, and you said you were Victoria and you're using the Riva Star silver diamine fluoride. Is that right?
I'm using, well, we were using the Riva Star. We just started probably the last 2 months using the CSDS, which took a little bit of getting used to because it's a lot more fluid. And yeah, a couple of the girls, oh my God, I've got black everywhere, but it's all good. The pictures you put up of that 3.7, that was fabulous, because I pulled that and I showed the girls. I said, look, don't stress. That's what it looks like when it's finished. And they were really happy after seeing that. Yeah. And the next one a week later, showing that it's sort of clean with the black lines. So we're actually thinking of, you know, those sticky grooves that you sort of, do we seal them? What do we do with them? I said to them, how about we have a little study where we do it with the CSDS and then we seal over it with some Fuji or something.
Yep.
And see how that goes, because then that's totally non-invasive and you're not touching the tooth at all, really.
That's right, because once you put a burr to a tooth,
it's forever. Yep.
You're condemning it to treatment forever. Exactly. And the other thing too is if you're going to use some silver fluoride under a GIC sealant, you know you've taken care of the bacteria, and that's what it's all about. I've got a little a video clip of silver killing bacteria that what's the time now? I haven't got time to show it now, but I'm going to put that up on the Q&A page, because it really shows you how the silver totally denatures the bacterial proteins, and it's just amazing. So when you see that, you can understand why it's important to have a bacterial kill first if you're going to use, you know.
We're also looking at doing the interproximal. You know, there's minimal interproximals on 6s that you just see them on the X-rays, and you don't want to go and destroy 90% of that marginal ridge just to get to that little bit of decay. No. And the case history that I've got in the 1.6 is it's on a 28-year-old,
and I treated her with silver fluoride because the dentist was actually going to drill in there to see whether it was decayed or not. And I'm going, no, you're not. She was my daughter-in-law. I said, no, you're not. not until we have tried silver fluoride. And so she was actually having sensitivity with that tooth. And she was like just sweetness sensitivity. The day we put the silver fluoride on, that all went away. And now we've been following that for, I did 2 applications on that because I was still learning, and I think it was worth doing. I did 2 applications 3 months apart, I think it was. And then we've just not done anything else. And she's a flosser and we're just watching it. If you looked at the tooth from the occlusal and you were a dentist and you were doing a checkup and you saw this darkness in there, you'd definitely go, oh my gosh, there's a big hole there. But what you're finding on the x-ray is that darkness is getting lighter and lighter. And as the tooth remineralizes, you get less evidence that there's any caries there. So that's why I'm passionate about giving people those post-treatment cards after they've had silver fluoride treatment, so that the next practitioner is well aware of those, that they've been treated. And I think that that's really important, the follow-up. Okay, so so if anybody needs any information or further information on how to, somebody was talking about the blackness. Okay, honestly, when you approach it correctly, there is no problem. And particularly, you know, even if it's on the front teeth and it's a 2-year-old, people will go, okay, that's better than having the tooth rot away. And then by the time the kids get, you know, compliant in the chair, and that can be as easy as a couple of, you know, like another 12 months, then they can have those teeth covered with whatever means you want to do. I often just do a GIC over the top, but they're so used to you being kind and gentle and not hurting them that they're fine. So I think I'm a bit worried that we're just going to get chopped off here. So we might end this here. If you've got any other questions, email Trudy and I and we'll answer them for you. And then if you think that this was valuable, let us know. And I've got a ton of case histories we can talk about, but I've also got a ton of people that I know that are using silver fluoride that will be happy to come along and share their case histories in this format. So if you think that that would be interesting, let us know. And I'll put this up on the page as, what would you call it, as amateurish as it was. Hopefully it will be valuable to other people as well. And thank you all for coming.
Thank you very much, Kathy.
Thank you, Kath.
That's all right.
Thanks,
Okay. Bye.
Yeah.
I'm just going to